Hello, my name is Ekaterina Kirillova. I am a third-year doctoral student at Wright State University School of Professional Psychology. And this project is about addressing ableism in the mental health care of autistic adults and evidence-based recommendations for clinicians. My faculty advisor for this project was Ryan Rose Seide. Oh, and if you scan this QR code in the bottom right, it will take you to a full copy of my poster for this project. So to start, autistic adults have help-seeking behavior that are 2 times higher than adults diagnosed with ADHD, and up to 12 times higher than other diagnostic groups. And so help-seeking behavior refers to both mental health services such as therapy, as well as medication management. Typically, when autistic adults are seeking out mental health care, they are looking for support for comorbidities such as ADHD, anxiety, depression, trauma, and others, rather than for core features of autism. And when trying to access treatment, they report many barriers, including communication differences and unmet sensory needs, as well as system-level barriers such as long wait lists and more rigid treatment protocols. So only assigning, you get this amount of sessions that are going to be covered by your insurance, and reporting that this often does not work, and the rigid approach is often cited as a barrier. Additionally, a barrier is that providers do not have the knowledge that they need or the knowledge regarding autism and how it impacts daily life, and can act as a barrier to accessing quality care. And so the problem is that even though autistic adults are trying to access services at a higher rate, they're also reporting higher dissatisfaction with the services that they are receiving. And so looking at all of this together through a liberation psychology lens, we could see that this dissatisfaction and the unmet needs in treatment are a result of ableism and systemic oppression of autism and autistic people. And so the research question was, how can mental health clinicians address ableism in the therapy room and better support adult autistic clients? So for the methods, I did a lit review looking at Google Scholar and Wright State databases, looking at keywords like autism, adults, mental health, liberation psychology, and neurodiversity affirming, looking specifically for articles that included autistic people, be it through interview or as researchers, and looking at the experience with mental health care, especially those that prioritize intersectional considerations. And so the results from this and the discussion, we see themes that provider level barriers such as stereotypes and lack of knowledge were particularly harmful, and that communication and sensory needs were a major access barrier to quality care. So once you already get into the room, we're seeing that these needs not being met exacerbates the difficulty with accessing quality care, and that there is a big need for collaborative, flexible, and affirming care for autistic adults. And so, going off these themes and off the literature, some of the recommendations would be to learn about autism from autistic people. Because so much of the research was focused from more of an outsider perspective and ignored autistic people's perspectives, it's important to now listen to the autistic voices. It's important to not have a standardized, quote unquote, battery of accommodations, and to work individually with each client to find what works for them, to move away from any deficit-based language and be affirming in practice, and to build provider-level flexibility into the treatment process. It's also important to consider intersectionality with autism and not just look at autism in a vacuum, but also consider other cultural identities and variables, both in treatment and in research. And here are my references. Thank you.